Now coming to what can you do when you start aging, when you start seeing the wrinkles, when you start seeing the tear trough, when you start seeing the jowls, what can you do then? Of course, you've been following all your skincare regime, whatever practices I told you now, but that's not going to prevent your aging forever. It may just postpone it for a while. But once you start noticing these signs, the earlier the treatment, the better for your skin. Now once you have followed all this regime and you're following all these regime on a regular basis, but you're going to age, still you're going to notice fine lines which are going to turn into wrinkles and then sagging of the skin. Not that this skincare regime is going to avoid it completely. To a certain extent you can postpone it. What happens once you start developing wrinkles and noticeable changes on the skin? That is when you have to seek treatment from a dermatologist. So what are the treatments we have to offer you? There are various modalities of treatment, and it's not limited to Botox and fillers, mind you. Many of them have this notion that anti-aging treatment is Botox and fillers, nothing else. No, that is not true. We have various modalities ranging from chemical peels, which are totally non-invasive and can be done as a lunch hour procedure, up to surgical lifts, which are operative procedures. So there is a wide array of treatment. Consult your dermatologist, see what you're looking for, see what treatment they can offer you, and choose accordingly. To begin with, I'll just brief you with all these procedures what we have available for anti-aging skincare. We have chemical peels to begin with. These are offered for people who come in the very early stages where there is mild dyspigmentation here and there, or maybe there is some amount of wrinkling which is just started appearing around the corners of the mouth, on the forehead. So these can be very well tackled with chemical peels. We have different chemicals to take care of these, ranging from very superficial to deep peels. So you'll have to consult your dermatologist to decide which one suits you best. You can take multiple sessions of these at a frequency of about every 2 to 3 weeks, and you can take about 4 to 6 sessions of these. And following that also, for maintenance, you can take one session every month to just maintain the skin what you've achieved. Coming to the next procedure, what we have to offer is laser resurfacing. Laser resurfacing can be either ablative or non-ablative. So the basic difference between ablative and non-ablative lasers is, ablative lasers are going to treat your skin from above downwards, whereas non-ablative lasers are going to treat your skin from inside outwards. So ideally the main difference for you would be ablative lasers, you're going to have a downtime of around 3 to 5 days, whereas non-ablative lasers, there is no downtime as such. And ablative lasers is given mostly for patients who have skin surface changes, as in dyspigmentation or mild wrinkles, whereas non-ablative lasers more for skin lift and for sagging skin. Next modality we have to offer is microneedling radiofrequency. Microneedling radiofrequency again has no downtime as such compared to lasers, and it causes tightening of skin, and it causes increased collagen and elastin production from within the skin, which gives a nice glow as well. This again has to be done in multiple sessions. Around 4 to 6 sessions would be ideal, and it can be repeated like as a touch-up. You can do 1 or 2 sessions every year. We also have energy-based devices these days like HIFU and Endymed, if you've heard of any. These are ultrasound-based, or these are radiofrequency-based devices which produce heat within the skin at the depth of either the fat or the deep dermis, what we call the deeper layers of the skin, and from there it causes tightening of the skin, it causes collagen and elastin increase. Basically for patients over 35 to 40 years of age who have sagging and who have lot of wrinkles, this do help, and these can be done just 2 or 3 sessions should help them. Can be done both for face, neck and hands also, and this can be maintained with 1 session every year. Now coming to the most glamorous part of the anti-aging regime, that is your injectables. It could be in the form of botulinum toxin or hyaluronic acid fillers. Of late we also have thread lifts, and we have vampire lift, which has become very popular these days, This is basically PRP done on the skin. So injectables, botulinum toxin and hyaluronic acid fillers, these have to be done by a dermatologist. You cannot get it done in parlors. Please take care of that. You should not be seeking these treatments, invasive treatments, with anybody other than qualified dermatologists. Okay, because these have very good effects and grave side effects as well. So you have to be very careful whom you take treatment from. Okay, so botulinum toxin is basically given for wrinkles on the face. It is given for wrinkles on the neck, on the hands. So what we do in botulinum toxin is we are going to inject a toxin where it neutralizes or it relaxes your muscles so that there is not too much wrinkling or crinkling on the face. Though the results are very short lasting, the results what you achieve are amazing and immediate. Within 48 hours you can achieve results. Next, coming to hyaluronic acid fillers. Hyaluronic acid is nothing but the same protein what is found under your skin is prepared synthetically and it is injected into areas where there is hollowness, be it your temples, hollow temples, or tear troughs under the eyes, be it your sagging cheeks, or to give a shape to your jaw. All these areas can be addressed with hyaluronic acids, and the results are immediate on the table as soon as we inject, and they last for a good 1.5–2 years, which is like really good. Okay, and the next modality is thread lifts, what we do, wherein we put threads or cork threads which actually go inside, deep inside, and we lift the skin from there. So what happens is there is fibrosis or there is reaction around these threads within the skin, and they hold the skin up like that. Again, see, no anti-aging therapy is going to last forever. These also have a duration of about 1.5–2 years till when you have that effect. Then you have to go for a repeat therapy. Coming to the last one is your PRP, or what we call the vampire lift, where growth factors from your own blood is injected into the skin on a serial basis, that is every month, so that you get a nice glow. Your wrinkles come down to a great extent, and they give that nice youthful appearance to the skin, and it can be repeated. And all these procedures are not exclusive. They can be mixed. You can take 2 or 3 procedures and according to your skin type. All that your dermatologist will be a better person to decide upon. So if you have any of these concerns, please consult your dermatologist and take the necessary treatment. But as far as I told you about the tips you can follow at home, your sunscreen, your moisturizer, your night cream, and your lifestyle changes, please do not forget that. That is the one which is going to help you in the long run. Thank you. Have a nice day and a youthful skin forever.